right about here. Just a little bit caudal to the kidneys. But the testicles obviously are way down here in the scrotum. So you might ask yourself, if you were talking head, why does the internal spermatic artery come from the aorta way up here if the testicle is way down here? It would seem to make sense to have it come off of some pelvic vessel or something. Well, the reason it doesn't is because the testicles weren't down here all the way, right? The testicles used to develop, they started development up near the ovary, and then they descend. And when they get to that inguinal ring, internal inguinal ring, they push through the aponeurosis. I showed you how they kind of take that, like when I put my finger through the glove, and then they end up descending down to the scrotum. So the scrotum is right here. There's like a little pocket where the testicle was. And I've got those out of the scrotum. And so this is the fascial sac covering the testicle. And then this is the spermatic cord, and it's covered by spermatic fascia. Remember, the spermatic cord has the cremaster muscle, and the fascial sac does not. And then if you look up inside the body, like right here, for example, we can see all the structures that go through that inguinal canal. So we have the internal spermatic artery and vein, and then we have the vas deferens. And once they get inside the body cavity, they go their separate ways. So vas deferens descends down on the posterior side of the urinary bladder and then becomes that ejaculatory duct. We'll talk about that again. So I can't show you those things in the cap, but I can tack the testicle, the spermatic cord, vas deferens. And I don't think the arteries are on this practical. I think they were in the earlier practical. This penis, however, comes through the pelvis. And so what we have here, and this, you can see this on the female cat as well, there's a muscle right here called the levator ani. And the levator ani is shaped like a funnel. And so if you look at me for a sec, the funnel comes around, and then on the ventral side there's a urogenital arch, there's an opening. And that's opening through which the penis comes in the male, and the vestibule or vagina and urethra in the female, depending on the arrangement there. So what I did was I split the pelvis as close to the pubic symphysis as possible, and then I got the penis out. Let's see, came out pretty well. Okay. And so when you look at the penis, you see it kind of looks like a space shuttle, right? So you got like the fuselage thing, and then you got the wings over here. And then it even has these little gas tanks right over here. So let's see if I can make this a little bigger. Okay. Whoop. Oh, I pushed the wrong thing. Sorry. Which probably means we have to start all over again. There we go. Good. Oop, there's my fingernails again. Kind of like them.
Blue is your color.
Yeah, I think it's kind of nice. Okay, so let me try this. Get everything a little bigger here. Okay, a little too big maybe. Let's try it. No, that's about as. It's better that you can see the thing even if it's a little fuzzy at this point. Okay, so right down here are the crura. There's one on each side. That would be like the wing of the space shuttle. And the crus is continuous with one of the erectile cylinders. So the penis has 3 erectile cylinders in it, 2 corpora cavernosa and 1 corpus spongiosum. And the corpora cavernosa are continuous with the crus on each side. Corpus spongiosum comes up the middle on the ventral side of the penis, and it has the urethra going through it. The 2 corpora cavernosa are just erectile cylinders that become filled with blood during arousal. Okay. And then, if you look right down at the base of the space shuttle here, you can see this little lentil thing or little gas tank. That's the bulbourethral gland. So it's kind of cool. Like the bulbourethral gland creates this mucus secretion, lubricates the urethra, neutralizes urine, and so I thought, women have all the same structures that men do. They just end up in different places and slightly different arrangements in terms of size and stuff. So I thought, probably women have a homologous gland, same origin, just a different outcome, and they do. The name of it's a greater vestibular gland, and the greater vestibular gland secretes mucus secretions into the vestibule of the female. So in a cat, the vestibule is internal. We'll see that in a moment. In the human, the vestibule is external, with the two openings being separate. Okay, so we got the glands of the penis, GLANS, up here, and then the shaft, and then the crura, and then the bulbourethral glands. Now, on the crura, if I were to tag that on a lab practical, you'd want to say crura or crus of the penis, because there's also crura for the diaphragm, right? And if I tag that, which I think is one of the ones that could be tagged on this exam, you'd want to say crus of the diaphragm. Everybody follow? Mm-hmm. So you have to specify what's the crus of, because there's more than one crus. Okay, so then if you look at the urethra right here, you can see the urethra gets a little bit larger. I think our union rep is here now. And the enlargement of the urethra there is the prostate gland. Okay, and as I told you before, the prostate forms from the urethral wall, and it produces prostate fluids, which are helpful with the ejaculation and all of that. But that's the good news. The bad news is that because the prostate develops from the urethral wall because of hormones, and because the hormones don't stop, the development continues. And so as a person gets older and older, the prostate gets more and more enlarged, and it starts to impinge on the urethra, and it can become problematic in terms of having material go through the urethra because it starts to impede the flow of material. Okay, so in review, we've got the glands, the shaft, the crus, the bulbourethral. What happened that time? This thing is a pain in the ass sometimes. That seems to be working.
It was like, I'm done.
Yeah, apparently it's like X-rated. There we go. We should have it here momentarily. There we go. Oh, my fingernails are back. Okay, so we have glands, shaft, crura or crus, bulbourethral gland, prostate gland, urethra. We have testicle and a fascial sac, the spermatic cord and the spermatic fascia, and then inside we have the vas deferens. So now I'm going to get a female cat over here